Hello, my name is Misaki Nguyen, and today I will be talking about how youth advocacy can be used to improve youth mental health in school spaces. So, before we get started, I'd like to give a brief self introduction. Again, hi, my name is Misaki Nguyen. I'm a rising senior from San Jose, California, and I attend Silver Creek High School. I've always really been interested in the intersections between the sciences, especially neurobiology, business, and advocacy. I really love innovating solutions and talking about ways to address social issues that I deeply care about. Some of the extracurricular hobbies that I have are that I'm part of my school's golf team. I play the alto saxophone in my school's band. And of course, I'm really passionate about the performing arts, such as dancing and singing. And in the future, I aim to be a psychiatrist. Before addressing, going into the nitty gritty, basically, we have to address school youth advocacy in the sphere of mental health, which we would first need to know the situation surrounding the current mental health epidemic. And when talking about such, the COVID 19 pandemic is definitely one of the largest factors. To catch a glimpse of that scale, the CDC conducted a 2021 survey to see how COVID 19 affects the behaviors and experiences of US high school students nationally. And according to the CDC survey, 37% of youth experienced poor mental health during COVID 19, and 44% experienced persistent sadness. The severe challenges students faced while at home with their families were even more staggering, with 55% of students reporting experiencing emotional abuse. While this data is limited to students in the United States, significant statistics are also found globally. Now, the importance of schools to maintaining youth mental health is also pretty significant, as school connectedness is the term the CDC uses to describe and highlight a sense of being cared for and supported at school. And students who didn't feel connected to their school were significantly larger than those who did, which also translated to almost double the rates of youth considering or attempting suicide. Now, in the light of this problem, two unmet needs have been made clear. One of them, after returning to the post pandemic life, it was difficult for students to interact with their peers again because they've been isolated for almost 3 years, needing social adjustment. That stress manifested as personally fights in my school at the beginning of the school year. There was clearly a need to help students' mental well being in readjusting to post pandemic school life. And reason number two, not only did post pandemic adjustment to in person learning have an impact on the students, but also to the school teachers and administrators as well, who interacted with the students as they readjusted to in person school life. I actually had the opportunity to present as a panelist at the California School Boards Associates Conference, where I discussed with superintendents across different school districts about the challenges they faced with students returning to in person learning. And so the main obstacles that they discuss there seem to be knowing what mental health resources they should be implementing, and most importantly, how they can engage students into utilizing those resources, which were again the same struggles that I identified at my school. So many as experts, like those superintendents, emphasize the importance of the affected groups participating in the advocacy and implementation process of mental health policy. So this is why I believe youth advocacy in the local school level is a central component of addressing the global youth mental health epidemic. Now, here is the question: how can we foster youth advocacy in school spaces? Now, according to the Roger Hart's ladder participation model, it shows that youth initiated and directed activities in cooperation with adults are the ideal situations to strive for. Now, what exactly can do that are what I call the school specific mental health youth advocacy groups. The mental health youth advocacy groups can work not under, but in partnership with the school administration to bring mental health services to the students and promote mental health well being. And by involving students from the affected schools, not only do the students capture the diversity of the student population, they also focus on issues that truly impact the students because, well, students know students best. They are actively living and knowing about the problems that need to be solved. So basically, while putting students as the face of change in schools, it really empowers students to take a more active role in mental health well being. So I truly believe in this based on my personal involvement and experiences with these youth advisory groups, such as in the Santa Clara County Office of Education Student Wellness Advisory Group, otherwise known as SWAG. With SWAG, we worked with school superintendents and administrators to advocate for mental health services available at schools. And as a result, each high school in my school district has a mental health and wellness center that students can freely refer to. We held seminars and conducted surveys to know the mental health climate in the perspective of students, which really shaped our activities. Having first being involved with SWAG, I then founded the Silver Creek High School Youth Advisory Board because I wanted to continue the youth mental health advocacy work of SWAG, but personalize it from a county level to a localized school level. Now, the Youth Advisory Board works with two social counselors at our school to bring services, such as right now, we're establishing a peer counseling program. We have also held a mental health and wellness fair on campus and presented at various district board meetings. The key takeaways I was able to learn from my work are first, the flexibility and creativity that is possible with student ideation. By having that mutual exchange between adult allies and student ideas, there's a lot more space for the exploration of ideas that would have been impossible individually. For example, in the next school year, we're planning on collaborating with our district to spread these youth advisory groups across all of our high schools, so as well as hosting conferences for our county. By having fellow students advocating for mental health and wellness, we are simultaneously destigmatizing mental health, allowing for more services to expand to. In May 2023, we received a grant from the Youth Leadership Institute, so we have confidence to carry out these activities. The potential of local youth advisory groups can truly be attested to the uniqueness that stems from youth thought. Like, not just limited to schools, the groups could also collaborate with the county and community organizations because really it is ultimately up to the student's ambition on where's the limit. Imagine potential, but on a global scale in many communities across the world. Students would effectively be the ones who take charge and change mental health and wellness for the better with real results. All right, so here are my references and acknowledgments. So many thank yous to one of my greatest advisors, Dr. Shawnee's Powell, and all of my teammates at the SWAG. You guys are amazing. Also, thank you to Ms. Harrington, Ms. Powell, our social counselors, and the SHS YAB team. I really could not thank them enough. So here's my contact information. Thank you so much to everyone for listening.